Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Well, thanks very much. Time for another community service program here on KGAF. And today, we're going to talk about what's going on at Munster Memorial Hospital. Brian Roland, the CEO of MMH, is here. Hi, Brian. How are you?
Hey, I'm doing great today. I'm very glad to be here and looking forward to talking with you a little bit and talking to the people.
Yeah, let's start with, I guess at the top of the list, you got some new doctors that are a part of MMH over there. Tell us about that.
We do. Last week we had Dr. Crow Rodney in town. She will be the new primary care doctor that's going to be coming in probably middle to late February. She was in town last week doing a meet and greet, checking out the clinic, sitting down having some conversations on what the long-term game plan is going to be for her. At the same time, yesterday, we had Dr. Naylor, who is a pediatrician out of Flower Mound, who we are having up in our facility once a month to kind of see how that works out, to see if that's a niche that we can kind of get ourselves into. So a lot of stuff going on. We're also working with a few more cardiologists to get them up to the specialty clinic. So there's just a lot of stuff going on with providers in Munster at this point.
Yeah, and that's important. It's important to the folks of not only Munster, but all of Cook County to have some of these specialists and whatnot available to them there in Munster, and meaning they don't have to drive to Denton or Sherman or the Metroplex to get these services. And that's a great thing, I think, that MMH is doing there. Another thing, and you and I were talking before we went on the air, healthcare these days is it's really dealing with the unknown almost daily, I know. But you've got a little, I guess, a little theme, a little mantra you're going by: managing today, preparing for tomorrow. If you don't do that, you can get yourself in a lot of trouble, right?
You sure can, because there's two prongs of this that you have to be looking at all the time. Is while you're looking forward to what's going on tomorrow and trying to prepare for the next 5 years, you have to make sure you're taking care of the business today, or you won't be here tomorrow. And in our case, you have to make sure that you're focusing on quality today, that you're following the regulatory requirements, that your staffing is what it needs to be, the training, the education, the employee satisfaction. You also have to make sure you're collecting cash that's due you. The money that you're supposed to be getting, is it coming in the door? Is it coming in the door timely? Because you have to focus on those things. But at the same time, looking at what's going to happen tomorrow. I mean, in our case, one of the big things that we're working on, especially with Dr. Crow Rodney, is not just, yes, she's going to come in, we need that primary care doctor, that's going to be that short-term jolt that we need to move forward, but what are the plans with her 3, 4, 5 years down the road? Because, I mean, Eric's going to be coming on board in a couple of years, so we'll have another doctor, so we actually need to prepare for how do we build the volume, so we need the doctors, so we can show that the need is there and keep them both busy along with the providers that we currently have. I think one of the interesting things as we go forward, and as we were kind of talking about, is the next 5 years starting in 2017 are probably going to be the craziest 5 years in healthcare. You look back at, and in June I will have been in healthcare for 25 years. In 2011, when you were looking 5 years forward, you were kind of looking at the 1115 waiver and other funds and ways to collect money or get money out from the government, where now we're looking at how do you prepare for what's going to happen with the Affordable Care Act, what's going to be here, what's not, what's going to happen in, what do we have, 25, 26 days before the election. Mm-hmm. What Medicare is going to do with bundling payments for physicians and bundling care. Our game plan is, our number one goal is how do we provide wonderful care to the patients in Munster and our hospital district, but the role that we play in Cook County. We're not just the other hospital in Cook County. Our goal is how do we strengthen the healthcare in Cook County and become the provider of choice in Cook County, because we have the tools and the means to do it, but you also have to do it in the right way. I think in the future, you're going to see alliances and things happen with groups or entities of pieces of hospitals doing different projects that help everybody, you're going to see people work together who normally wouldn't work together in the past. Because what's going to happen is if you don't have that, you're going to see hospitals fall off the map again. I mean, we had a hospital just, I guess it's been this last week, that filed for bankruptcy down in South Texas. There was one in Oklahoma that filed for bankruptcy a couple weeks ago. And these are rural facilities that didn't think far enough ahead, in my mind, and I don't know what goes on in their individual facilities. And our goal is, how do we ensure that that doesn't happen to Munster and the healthcare in Cook County as a whole?
You mentioned one of the important things is making sure that you're getting paid for the services you've rendered. And I don't think it's a secret that has been a problem in the past at Munster, Gainesville, several that I'm aware of. How is that situation now? Is it improving? I think folks would like to know that.
For what's happening in our facility, it is. We're changing the way we look at the reports that we run, making sure that we have the policies and the processes in place to collect the money that's due us. And this isn't just technically from the patient side. This can also make sure that we're getting paid correctly from the insurance side. A lot of times you don't pay close enough attention to, even though I have a contract with XYZ insurance company, are they actually paying me what they're supposed to? And now you get to the point where you have to scrutinize it to the point where, am I getting paid to the dollar what is owed to me? And putting those processes in place in those audit steps and all of those other things to ensure that that's happening. And that's one of the big steps that we've done in the last year or completed, and we're still working on some of the pieces now to ensure that that's happening.
Yeah, very, very, very important, and hopefully that is getting in line. Let's talk a little bit more about alliances. Some people may not understand, because we throw out a lot of terms in our world today that may not make sense to a lot of folks. Talk about alliances, what those actually are. I guess basically it's working with other healthcare facilities.
There's different steps you can take, and I'll try to do the abridged version of this. You know, a lot of times in a rural healthcare, you have to work with larger tertiary facilities or smaller facilities that surround you, and you can have a working relationship. You know, hey, we're going to do this, we're going to do this, we're going to come to your meetings or whatever. But that alliance, which is that first step, it's kind of like dating. It gives you a chance to kind of work with a larger tertiary facility. You might be able to utilize some of their services for training and educating your nursing staff. You can order some supplies maybe through their vendors, which will help save you money. But then you can also work on projects with them that are specific to your own entity, and work, and you can have alliances with 2 or 3, 4 or 5 different hospitals depending on what you want. You know, then you may want to get to that next step where, you know, maybe you want to get engaged. So you're talking about a management agreement. You know, you're still your own person, you're still your own, and you can always walk away at any time. But it gives you more of a strength where you might be able to utilize their insurance benefits and some other things because you're tied in. Now, you draw a fine line, because once you go past that, it's like getting married. You know, then you're talking about a merger or an acquisition or things along those lines, and there's a lot more involved in that. So in my mind, that, you know, and I'm not saying you want to date a lot of people at one time, but there are things that you can do with a Texoma Medical Center or a Denton Regional or a Baylor Heart that you can't do with the other entities. So you want these different relationships. So you can draw from those. And again, if you utilize them in the correct way, it helps strengthen your smaller organization. But there's also a lot of things that you might bring to the table because of where you're located, or things that you can do, or your thought process.
Mm-hmm. It's kind of like Daddy always said, it's smart to play the field before you decide who you're going to lie down with, right?
Well, I'm not sure if I'll go there, but yes, definitely.
Well, I'm glad to hear that Munster Memorial is getting involved and working on those different alliances and just strengthening healthcare here in Cook County and playing a larger role in what's going on. Brian, I wish we had an hour to spend, but we don't. But we'll do this again probably next month, okay?
That works for me. Thank you very much.
Thanks very much. Brian Roland, the CEO of Munster Memorial Hospital. That's going to wrap it up for our program here today on Hometown Radio, 1580 KGAF.